Hair loss is a reality for millions of men and women around the United States. NeoGraft, though, is a hair restoration system the team at the Bengtson Center is using to help patients. The team uses advanced technology considered to be the gold standard in the industry. In fact, Dr. Alfonso and Dr. Bengtson also had the treatment done themselves. So we have Dr. Alfonso here today to talk with us, along with Katrina, who is one of the PAs who performs this special procedure for patients. Thanks for stopping by eightWest today. So, Dr. Alfonso, let's talk about this. You had the procedure done yourself a couple of months ago.
Yep, end of December.
Okay.
Yeah. So it's a really great procedure. It's done under local, basically anesthesia, so you're awake but relaxed with some medications you take right before the procedure. And as you'll see with some of the graphics here, basically the concept is an advanced way of taking hair from the back of the head. And men tend to have what we call donor dominant areas, so that the back of the head tends to have good hair follicles even throughout later in life. And transferring those follicles to the front and the top of the head, where hair loss tends to be the most typical for males, but also in females as well. And you know, one of the great things about this technique is that in the old days there used to be a big scar in the back of the head where a surgeon would take a long strip of skin and hair and cut it up. Now they're literally just taking individual follicles and leaving the back of the head to grow in, to fill in the area with no scarring.
And so you shave the back of the head. Is that so that you're able to precisely just grab each follicle through the course of the procedure?
Correct, yes. That way we're able to get just one individual follicle. So as we're taking those individual follicles, then we're able to just plant one hair at a time into that transplanted area up front where we need that extra density.
And so is the idea then that those follicles are still able to produce hair because they're doing that in the back of the head, and so you just transfer those into the areas where a patient has follicles that maybe have become, is it inactive over time?
Yeah, so as we have hair loss there, our hair follicles at the back of the head are actually resistant to DHT, which is the cause of hair loss. So it maintains that kind of resistance to it. So the hairs that we're planting then end up being permanent up front.
Yeah. So what made you decide to go ahead and go through with the procedure?
Well, a couple things. It was awfully convenient, right down the hall from my office. But you know, it was something I had been interested over time as me, like many males, getting into the 40s, start to notice patterns of change in their hair pattern growth. And I thought it was a great opportunity. Plus, I wanted to be able to obviously promote it and have the experience of having gone through it. So I've been really happy with the recovery, and I'm starting to see some of the growth now. There is a phase of growth immediately after the procedure. The hairs, they grow for a little bit, and then they kind of go into what we call a dormant phase, where they're kind of in shock and not happy about being moved around. And then they do that, and some actually will fall out, and then they start to grow back within a few months much more vigorously. And that's when you start to see really thickening of the hair in those areas, and that's where patients start to really notice the improvements.
Yeah, and so you think of men, we think of hair loss, but a lot of women also suffer from hair loss, and it becomes one of those issues that may be even more difficult for them to try to find some kind of a solution. Are you finding the results are equally good with men and women who are patients who are going through this?
Yeah, I think, you know, if you look at the overall statistics related to NeoGraft, it's greater than 93–94% take of the grafts. So if you have 3,000 grafts, 93–94% of those grafts are going to survive the process, and even if they go dormant, they come back later on and are growing in much more vigorously. So it has a very high success rate because of the fact that you're taking individual hairs versus the older days where they would take larger segments of multiple hair follicles.
And what's the process like as you go with a patient? They go through some local anesthesia?
It's a long day for them. I mean, they arrive right in the morning, but I mean, a little bit afternoon and everything, the patients are leaving, they're awake, you know, and within about a week of social recovery, they're able to go back to normal activities after that. We want them to be doing other things for preventative treatments at home to make sure that they're maintaining their hair. But beyond that, I mean, it's a pretty easy, you know, treatment to go through.
Wow, it makes a whole lot of sense. Okay, Dr. Alfonso, we have you here. We're obviously a little bit different in our blocking here. We are practicing some social distancing. What are you doing at your office? Because I know you have a lot of close contact with your patients, and you have a beautiful facility, but you have to be taking some specialized steps as well and precautions to keep your patients safe.
Yeah, definitely. Obviously, we're following all guidelines from both the Michigan Department of Health and the CDC. Some of the new things we've implemented starting this morning and for the next few weeks, basically screening patients as they're coming into the building, even before the office, with a brief questionnaire to see if they've had history of travel, international or domestic. In addition to actually taking temperatures and recording those, we just want to make sure sure that we're not having people in the office who are starting to get sick and spreading that in our office. We also have our providers who are going to be in close contact with patients wearing masks, just for protection of the provider, but also for the patients. And we're just trying to limit the number of people that come. We're really asking patients to come basically on their own. If they're post-operative or if they're getting a procedure done, we request that they come with one person so that we're just limiting the overall traffic. We clean all the time. We have a great cleaning service. We're doing extra cleaning throughout the day, especially on multi-use areas where people tend to use their hands a lot. Door surfaces, light switches, all those things. Thankfully, in our office, a lot of those things are automated. So most light switches turn on when you go in the room and turn on when you leave. You actually don't need to touch it. Same thing with a lot of the doors. With your badge, you badge, the door opens. So that in and of itself helps to limit the amount of touch points for our staff and for patients in the office. So we're treating it very seriously. We're still providing our services to patients. We're just doing it in a way that we feel is the safest.
Yeah, and if you're interested in checking out NeoGraft or any of the other wonderful procedures located at the Bengtson Center, we invite you to stop by their website, thebengtsoncenter.com. Thanks so much for stopping by eightWest today, and your hair looks great already.
Thank you.
Seeing some results.
Yeah.